Hi, and welcome to a CUNY TV virtual town hall, COVID-19, vaccinating children and moving forward. I'm Mike Gilliam. We're now past Memorial Day, a weekend that saw many Americans reviving traditions and spending time with one another, unmasked and in the mood to celebrate. Air travel reached a high not seen since March of 2020, and stadiums, parks, and venues are seeing people flood back. Here in New York City, once the epicenter of the pandemic in this country, life is beginning to return to so-called normal, with the vaccination rate as of this taping somewhere around 50%. The percentages skew older, meaning that almost 85% of people in the 65 plus age group are fully protected against the coronavirus. In May, the Center for Disease Control and Prevention approved the vaccine for children aged 12 to 15. As of this taping, 23% of people under the age of 17 have gotten one of the 3 shots in the US. Vaccinations are declining overall, and certain areas of the country continue to have low rates. But overall, the numbers are trending in an upwards direction, and this includes children. But with kids getting the shots, outdoor and indoor masks and social distancing mandates being lifted, and some states fully back to normal, is it all happening too soon? Will the coronavirus variants be a major issue moving forward? Is the feel-good story of President Biden's July 4th nationwide reopening target ignoring the concerns of essential healthcare workers and others who work closely with customers, like retail workers, servers, taxi drivers, and the like? And will this pandemic prepare us for the next one? Here to go over all of this are Bruce Y. Lee, contributor to Forbes and a professor at the CUNY School of Public Health; Lisa Baum, a health and safety expert with the New York State Nurses Association; and Dennis Nash, a professor of epidemiology, also from the CUNY School of Public Health. Welcome to all of you. Bruce, the Biden administration is calling June a national month of action and making a real push to reach his goals of 70% of Americans having at least one dose of the vaccine by the 4th of July. How important is a push like this?
Yeah, Mike, we've actually shown in a study that was published in the Journal of Infectious Disease recently, the importance of getting high vaccination coverages, so preferably over 70%, 75%, prior to the fall and winter. Certainly the sooner that we can get vaccination coverages high enough, the better, because essentially what you want to do is you want to stop the spread of the virus. You want to reduce the options for the virus to infect people. And you want to reach these quote unquote herd immunity thresholds to really stop the spread of the virus.
That's interesting, because that's one of the questions that a lot of the people that I talk to about this have, whether or not once we go back inside in the fall and winter months, if we're going to have another surge, or are we putting this in the rearview mirror? Dennis, how do you feel about that?
Well, I think, as Bruce says, the higher we can get coverage, the better. And I'm glad to hear the Biden administration focusing on that in addition to reopening. It's really important to be doing both, because they kind of go hand in hand, in my view. And we are going to be in a much better place in the fall, this coming fall, than we were last fall because of the vaccines. There's no doubt about that. We'll have lower community transmission, and we'll have a higher proportion of people who are, just going to be able to block the onward spread of the virus, whatever's left of viral spread going on in the fall. But I do think we have to be clear that it is very likely that there will be still ongoing transmission in the fall. It might be at lower levels. We don't yet have a plan for very young school-aged kids to be vaccinated yet. They all are going to be going back to school in person in many places. And so we need to remember that vaccine coverage needs to be as high as possible, and also that vaccines are not 100% effective. We have really amazing vaccines, like the levels of efficacy that we've seen, well above 90% in some cases, are really impressive. and that's really going to serve us well. But they're not going to protect everyone, and that's something I think we need to keep in mind going forward.
Lisa, a lot of numbers look very good at this point, but is this happening too soon, this reopening?
Well, the country has had a history of, during coronavirus, of opening up too soon. What's typically happened is a state locks down, starts to see improvement because they lock down, and immediately opens up again. It's understandable why this happens, but from a public health perspective, it's dangerous and we don't seem to learn from it. We do it again and again. While it may be safe now for unvaccinated people to take off their masks under certain conditions, it is not now, nor will it be for a long time, safe for unvaccinated people to do that. What the CDC failed to take into account when they recently changed their masking guidelines is that a complex message with a lot of variables does not get through to people. I've spoken with colleagues in other parts of the country, and they've said everyone has removed their masks, they're done. And it also sent a message to people that this is over. But if you look at the data, for example, that the Washington Post recently analyzed, for those who are unvaccinated, their risk of becoming infected is just as high now as it was in January when we were in the midst of a really significant national surge.
Yeah, one of the things, though, that I found interesting in one of the articles that I read was that when the CDC relaxed those rules, everybody thought things were going to just be terrible at that point, that all those people would take off the mask and other people would just be willy-nilly and not following the social distancing and all that. But Bruce, did that really happen?
It is true that there are people who are still following social distancing and wearing masks, but the question is, who's doing that? Are they the people who are vaccinated or the people who are unvaccinated? One of the concerns is that if someone may be inclined to not follow public health recommendations in the first place, meaning not getting vaccinated, will they be more likely to not wear masks? And will they be more likely to not social distance? And one of the challenges after the CDC announcement or the change in guidelines is there's no real way of determining whether someone's been vaccinated. If you're going to tie specific activities and guidelines to whether you're vaccinated or not vaccinated, then unless then you're either left to rely on the quote unquote honor system that people will say they're actually vaccinated or not vaccinated accurately. If we have a situation where there are people who are not being straightforward in terms of their vaccination strategy or their vaccination status, then how can we separate and have different activities or different guidelines for those who are vaccinated versus not vaccinated? We either have to have the same guidelines for everyone because it's easier to monitor, or we have to have some way of really determining whether people are indeed vaccinated or not.
Dennis, I see you.
And that has a significant effect for workers, particularly essential workers. If I am going shopping in a store and I walk in and I see many people without masks and I feel uncomfortable, I can turn around and leave. But for people working there, they cannot. And, under workplace health and safety standards in this country, the employer is required to maintain a safe workplace for all their workers, not just vaccinated workers or workers with strong immune systems. So we need a system in place that protects all of our essential and non-essential workers.
Mm-hmm. Dennis, that kind of brings me to one of the concerns that I've had and that I've thought about concerning all this, and that is, as far as an employee is concerned, what rights do I really have there to make sure that that workplace is safe? I mean, shouldn't I be able to say to my employer, hey, I want to know that everybody I'm working shoulder to shoulder with is vaccinated?
Yeah, well, I mean, I think that workplace safety has really never been like on the forefront of the public health agenda as part of the pandemic response, and it still really isn't. Like, I think that let's just start with the CDC guidance. It really didn't really attend to those issues very much at all. And there was a time where I really felt that the CDC was not taking a public health approach at all to its recommendations, and more just saying, look, you should get vaccinated because it'll protect you. Which is, not what the CDC is supposed to do. They're supposed to be thinking about entire populations and vulnerable populations and essential workers, people who have to work indoors around other people as one of those groups.
Lisa, let's talk about that. What would you like to see done as far as nurses and healthcare workers are concerned to make sure that they're safe on the job?
There should certainly be an emergency temporary standard issued by OSHA, followed by a permanent infectious disease standard. I don't think there has ever been any other time in US history where so many workers in a single industry died from the same cause in such a short period of time. And the US government has done next to nothing to protect them.
So what standard would you like to see?
An infectious disease standard that goes beyond just diseases that are spread through blood and include diseases that are spread through contact, droplets, and airborne transmission.
A big push is being made now to vaccinate kids, people that are 12 to 17 years old. How important is that going to be going forward as we still seek to get to this very elusive herd immunity? Bruce?
Well, we were shown over the years, and this is many decades of research, that kids tend to be greater spreaders of respiratory viruses. Because if you think about the activities that kids participate in, many group activities, many situations where they aren't maintaining social distance or, keeping masks on their faces and, mixing in schools. So for instance, during the flu pandemic back in 2009, schools were a focal point because with the flu, we know that kids tend to be, they may even be super spreaders of the flu. So what they do is they pass the virus along to each other when they're playing or in school, and then they go back home and they can bring the virus back home where there are more vulnerable people at home who can contract the virus. So we do know that, yes, when kids are infected with the COVID-19 coronavirus, they may be less likely to develop more severe outcomes, but it's not completely off the table. There have been kids that have developed more severe COVID-19 and that suffered the consequences. But beyond that, even if they don't have severe disease, they can spread the virus to other people. So that includes people who are not vaccinated. That also includes people who are vaccinated, but may have what's called breakthrough cases. In other words, even though they're vaccinated, they still may be infected with the virus.
So it's more than just a numbers game as far as trying to get those numbers up.
Yeah, that's something important to remember. Like when we see these gross numbers, like 50% of people have gotten vaccinated, or in some cases, 70% in certain areas. Those are general numbers. What's more important is the percentage of people around each person. So if you have pockets of people that are not vaccinated, where vaccination rates are fairly low, that increases the rate significantly. So your risk is really dependent on how many people around you are vaccinated, like immediately around you. And I also should add that vaccine effectiveness is not like a single value for everyone. It may fluctuate from person to person, and it's highly dependent on people around you, because we have to remember the clinical trials were done when people were social distancing. The clinical trials were done when people were taking other types of precautions. So if people around you are not vaccinated, the actual vaccine effectiveness may actually be a little bit lower, and we don't know how much lower. So we have to keep in mind that vaccination is not just an individual intervention, it's a group population intervention as well. So you're really helping each other when you get vaccinated.
Dennis,
just
is
wanted
that where you
to
would like to see the focus though right now on children and on kids getting them vaccinated, or would you like to see them go more towards those who are hesitant?
well, I think the two are related. And I think, a lot of times the decision for a child to get vaccinated, especially a younger child under the age of 12, which we need to be thinking about because those vaccines will be available probably in the fall, maybe before. The decision for these children to get vaccinated usually falls to one or both of the parents. And we have vaccine hesitancy um, challenges with, and even vaccine resistance challenges, and meaning people resistant to the idea of getting the vaccine for themselves as adults. We've done some studies that have shown that those parents that are of young children that are themselves hesitant or resistant feel exactly the same way for their children when it comes to getting the vaccine. So if we really wanted to do a good job to address vaccine hesitancy, we would start by doing it for adults, but with an eye towards understanding that some of these issues are going to be there for and getting in the way of increasing coverage of vaccine for children as well.
Okay. The Biden administration has pushed for the 70% by 4th of July. Was that a good decision? What do you think about that? Bruce, let me hear from you on that.
Well, I think it's important to set aspirational goals. We have to remember that when you set goals, there's several reasons. So one is it's an aspiration. It's something to aim for. It's a target. Two is, another reason is to actually reach the target if you can. So I think in terms of aspirations, it's helpful to say, okay, this is what we want to reach, and setting it in the summer is important because that predates the fall and the winter. Now, whether we're actually going to meet that level, given the current rates, the fact that rates have slowed down, it might be a challenge to actually reach that level. So the third thing that setting that goal does is it says, okay, if we're not going to actually reach that goal, what do we need to change? What do we need to alter in terms of what we're doing to actually reach that goal? So it's a milestone. You say, okay, we don't think we're going to reach it. How do we amp up increasing the number of vaccination locations? How do we increase communication and education efforts? How do we engage community leaders? This thing is really important, engaging community leaders, engaging people who are local, because people tend to listen to people who they know already, like people who are actually within their sphere, within their community sphere. So, you'll see people saying, oh, did you get vaccinated, or did you get vaccinated? What's your concern, et cetera. So hearing it from someone, who's far away, even if that person is a celebrity or what have you, may not have that much effect. But hearing it from your family member or hearing it from your local teacher or clergy or business owners, et cetera, can be a lot more effective. So you really need to engage those people, and that takes effort and money and time. So
I noticed that one of the things that the Biden administration is doing for this month of action is they're in minority communities going to have things at barbershops and black beauty salons and that sort of thing in an effort to get people to come in, talk about that, and also at some locations get a vaccine. They've also done things on the other hand, like talk to the airlines. There's one airline that's going to be giving free travel for a year to a person who's vaccinated. So they are kind of moving in both areas, it seems.
Yeah, it's really important because you really have to engage a very diverse audience when you're trying to explain the importance of vaccination. There's been many communities that have historically had poor access to healthcare and may have mistrusted the healthcare system, and many times justifiably so, because they have felt neglected, or they have felt like the healthcare system hasn't been there for them. So you really have to overcome that. And in addition to that, we can't have a situation where there is the image that it's one demographic group telling another demographic group you should be vaccinated. You really need to have a diverse population of people who are involved in the vaccination program, who are helping communicate about the vaccination program, and who are leading. This is really important. the leaders need to be diverse themselves, because otherwise it sets up this dynamic where it seems like, you know, one demographic is pushing something on another demographic.
Yeah, I like some of the ads that the city came out with where they showed a number of people of color who were involved in the healthcare profession talking about vaccines being safe and that sort of thing. Lisa, from your standpoint, is there a larger role that nurses and people in healthcare can play in doing this so that it's a situation where you're using, you know, your knowledge of what the horrors that you experienced over the last year to help people understand that, hey, this is not a joke here, and we're here for you. Is there a role there?
Sure. And some nurses have, in fact, filled that role. There is a national network of nurses who respond to emergency situations throughout the world. And right now, they're in the US, reaching groups that have difficulty accessing vaccines. I have been very disappointed by certainly the Trump administration, but also somewhat by the Biden administration. We knew that certain groups were likely to be hesitant or even more resistant than hesitant to getting vaccinated long before we had the vaccines ready. We knew there would be people concerned about the science used. There would be people concerned related to a history of distrust in the medical system because of years of abuse and maltreatment. We know that we live in a world of conspiracy theories now. We live in a divided country where science is one of the pawns. So, and there are people whose specialty, including public health nurses and other public health workers, who specialize in messaging and how to reach different groups. This is not a one-size-fits-all type of approach. And monies and resources should have been given to these groups from the get-go so that they would have the ability to reach groups at a national level as well as at a local level with the right people, because different people have different reasons why they may not want to get vaccinated, and you have to approach them in a way that will be successful. That has not happened as much as it should have, nor has it happened as quickly as it should have. That doesn't mean we're done for. It can still happen, but it's not as if this is something new that we don't know how to deal with. There are many people who do know how to deal with this.
I would agree with Lisa very much. Like, a lot of this could have been anticipated such a long time ago, and we could have devised strategies to roll out the vaccine, to market the vaccine in ways that anticipate and therefore avoid this, you know, very uneven and I would even argue inequitable rollout of the vaccine. And as a result, when it comes time to sort of push forward with opening up, we're focused on, you know, a single metric of, say, a country or a state or a city around the proportion of people that are vaccinated. But in reality, there's many pockets that are vulnerable and are being left behind and being left open to risk as societies open up. I've been very concerned about the premature opening of New York City, where we basically had our politicians encouraging, during a pandemic, everyone from outside of the city to come and mix and go on our subways and shop and dine indoors and bring their kids, and then also people from other countries, or at least Broadway's, you know, a little ways off. But that is a very big calculated risk. And to answer your earlier question, Mike, I don't know if we know if it was the right decision or not yet. I think time will still tell whether or not that was a good decision or a bad decision. I would have liked to see opening up tied more to achieving certain milestones on vaccine coverage, not just for the country as a whole, not just for the city as a whole, but for everyone, so that we're not leaving people behind and vulnerable.
What about
I think I agree with that. And setting dates arbitrarily is not using science. The other thing that we have not done is, if we're sending people back into indoor spaces, either for entertainment or for work, we need to require controls for the virus that we're currently working with. And now we get back to the problem of the CDC recognizing airborne transmission of this disease. What you need if people are going into indoor areas is adequate ventilation. Cleaning is not the issue. Doing the screening, health screenings before people come into work is not effective. What is effective is adequate ventilation.
One thing that's notably absent from all the discussions is like, what if we get to a level where we're going to need to walk things back? And what level is that? And I think it's very concerning that our leaders have not specified that cutoff either.
Okay, that's going to have to do it. It's been a great discussion. COVID-19, a crisis in motion. I want to thank our guests for giving us a feel for where we might be headed in the coming months. Thanks to Professor Bruce Y. Lee and Dennis Nash of the CUNY School of Public Health and Lisa Baum of the New York State Nurses Association. Sure feels like we're going in the right direction, and all of our hard work and sacrifices are beginning to pay off. Onward and upward. And thanks for all that you've done to help us get back to the point where we can say it looks like we're headed back to some sort of normalcy. I'm Mike Gilliam. We'll see you next time, and stay safe.